While there are far more health risks with being obese, there are also considerable problems with being underweight. Especially if you are underweight due to a disease, some sort of illness, lifestyle habits, or malnutrition. Well, remember, of course, that both weight and fat measurement cannot tell you what an underlying issue is. So in order to determine what that might be, a complete health assessment is required. That is going to include a dietary analysis, a full medical history, including information about your family, a physical examination, and doing blood testing. So there are times where someone who is underweight, particularly if you're older, you may not be able to maintain body tissue against when you're dealing with a wasting disease like cancer or tuberculosis. And the problem is especially great if the disease is accompanied by malnutrition. You will remember that oftentimes people who are quite ill don't really want to eat because they don't feel well enough to eat, or they may face nausea and vomiting. When you are not consuming enough in terms of both nutrients and caloric intake for energy, you're going to have a much harder time fighting against a disease. Frequently, people who have cancer die of malnutrition and starvation, not necessarily from the disease. If you're a woman, and are underweight, particularly if you're severely underweight, you run a fairly high risk of having menstrual issues, and you can become permanently infertile. So being underweight or losing a significant amount of weight are associated with osteoporosis and the concurrent or associated bone fractures in females. I am sure you know many of the health risks associated with obesity. You've heard them here, you've heard them in the media, you've heard them other places. They are so staggering that being excessively overweight is now considered a disease. There are many, many secondary health issues that are directly correlated with being obese. And there are things that you've heard before: diabetes, hypertension, CVD, stroke, sleep apnea, osteoarthritis, a lot of cancers, gallbladder disease, respiratory problems, complications with pregnancy, etc. Obesity increases risks when you are undergoing surgery also, because it puts additional stress on your cardiovascular system, and it can also take longer to heal wounds. A couple of videos, and I'll catch you in the next section.